So I welcome you all to the first thematic session of the conference, which is integrating plant and animal solutions towards healthy, sustainable diets. Our co-chairs for this session are Dr. Inge Brouwer and Dr. Renuka Silva. Dr. Inge, I've already introduced. She's a CGIS Science Program Director on Better Diets and Nutrition and holds a PhD in Human Nutrition from Wageningen University. Dr. Renuka Silva is professor at Wayamba University of Sri Lanka and is the former president of the Nutrition Society of Sri Lanka. He leads the CGIAR initiative on fruits and vegetables for sustainable healthy diets, or it is called FRESH. Welcome both of you, and over to you for taking the session forward. Just one housekeeping announcement. Presenters will come one by one to make their presentations and go back down to the audience. And for the Q&A, then everybody will come up here and sit here. We don't want to block the screen so everybody can see your full presentation. So come, make your presentation and go back, and then come up again and sit for the Q&A session. Over to you.
Thank you very much, Esha, and welcome again after a tea break and a nice picture that we made all together. I hope we can see each other in the picture. Welcome to this thematic session with the topic on integrating plant and animal solutions towards healthy and sustainable diets. As you know, I'm director of the CGR program on better diets and nutrition. So I'm really happy with this session because we are really convinced that diets matter. It's very important to put emphasis on what people eat, because it's determining a lot what's happening with our health later in life. But it's also determining what's happening with our food system. So diets are both a consequence as a driver of the food systems we have, and also the performances of the food systems that are actually negative for our food environment. Talking about healthy diets means that we have to strive to a moderate diet, a balanced diet, a diet that's nutrient adequate, and a diet that is safe. And we all know that there is no food who can fulfill all these requirements of a healthy diet, except maybe for breastfeeding in the first 4 to 6 months. So this means that we have to work on different food groups, not only on plant-based groups, but also on animal-sourced food, on animal and aquatic-sourced foods, all together to improve our diets. And that's a reason why I'm so happy with this session, to see and to discuss how we can integrate, the different solutions that we have on plant and animal-sourced food solutions. And I have to say animal and aquatic-sourced food solutions. So we have an excellent program for you today, this rest of the morning, where we have several very interesting presentations on this plant and animal-sourced foods. And I would like to ask my co-chair to introduce a few introductory remarks to this session as well.
Thank you very much. So it's my honor to welcome you to this the thematic session, and also I'm delighted to co-chair this session with Dr. Brouwer, the director of the Better Diets and Nutrition Science program at the CGIAR. So this session, as she already mentioned, brings together a diverse set of perspectives and research findings from various countries, Bangladesh, Nepal, and international partners. So collectively, these contributions highlight the integration of approaches spanning from livestock production, the crop innovations, and community engagement, and nutrition-sensitive agriculture. So I think this interesting lineup will give you a lot of insights in the next hour and so. So let's start the session. So we have the lineup, but the first presenter is not here today. So we start with the second the presenter. The presenter is Milan Dakhal, from Haifa International Nepal, and she's going to talk about the strategies to identify and overcome barriers to milk consumption among vulnerable household members in rural Nepal. So each presenter has 10 minutes, and thereafter we will have a Q&A session.
Before you start, can we ask the presenters to come to the front? Maybe sit in here in the first row so that we don't take time, for you coming on stage. Please, Milan, go ahead.
Good morning, everyone, and namaste. I'm delighted to present our work strategy to identify and overcome barriers to milk consumption among vulnerable household members in rural Nepal. Okay, here we define children under 5 age and adolescent girls as well as women of childbearing age as a vulnerable household members. Here is the outline of my presentation. Okay, as we all know, animal source food is nutrient dense and highly viable source of protein and several vitamins and minerals. Yet in Nepal, the daily intake of animal source food is very less than that of the recommended. Animal source food is important for fetal and child growth, brain and bone development, prevention of anemia, healthy pregnancy outcomes, and moreover for the overall health and well-being. Milk is considered as one of the most commonly consumed animal source food in Nepal, especially among young children. However, the consumption is very low at around 50 to 100 ml per day. It is also considered that low animal source food consumption is associated with high risks of malnutrition. So milk consumption is affected by several factors at different levels: individual taste preferences, personal beliefs and myths, intra-household food allocation, cultural beliefs, economic factors such as income and price, and more broadly on social and environmental factors. Therefore, for the sustainable increase in milk consumption, it requires multiple levels of interventions. Our work was carried out in Banganga municipality with the generous support of Livestock System Innovation Lab. Now the objectives of our work, the objective was to provide comprehensive nutrition intervention to promote consumption of milk and other animal source food by vulnerable household members, and more specifically to assess anthropometry, diet quality, knowledge, attitude, and practice, and to compare the results with control group. Now let's move to the methods. We used quasi-experimental design with mixed methods. The baseline was conducted in June 2024 and inline in July 2025. However, the intervention had to be stopped in March 2025 due to the funding restriction. Altogether, we surveyed 836 households evenly distributed in intervention and control arm. Parents of children under 5 years of age and or adolescent girls themselves were interviewed, and anthropometric measurements of children, adolescent girls, and non-pregnant women of childbearing age were taken. 24-hour dietary recall was carried out to collect the dietary related information, and for ASF we collected both frequency and quantity consumed. Further, during the baseline, we also held 9 focus group discussion and 3 key informant interviews. Now let's discuss some of the core interventions of our project. The first one is the nutrition education session provided regularly to mothers, fathers, and adolescent girls group. And second one is the participatory learning activities to identify the local nutrition problems and find their solutions at the local level. The next is the model kitchen, where cooking demonstration was performed and where mothers and the adolescent girls prepare and share nutritious ASF recipes. The last one was the nutrition club with fun activities and also with the ASF ambassador mobilization. Now let's look at some of the baseline findings. The table here shows the ASF consumption by different household members. At the baseline, all the household members, more than 90% of the household members consumed some of the ASF past week. However, when we look at the milk consumed in 24 hours, we can see that the children and other household members were only most likely to get milk, and the adolescent girls the least. Similarly, when we look at the other table, the table shows the frequency and quantity of milk consumed by different members of the household. The average daily consumption was around 232 ml for children and 211 ml for mother and only 196 ml for adolescent girls. All of the consumption were below the recommended level. However, though around 63% of the household owned milking animals, however, the consumption was very low. Now, the baseline survey identified inadequate nutrition knowledge or practices and local food beliefs as one of the major barriers to milk consumption. More than 50% of mothers and adolescent girls could not answer the sources of protein or iron-rich foods. Moreover, the intra-household food allocation was highly inequitable, with women in more than 50% households serving at last, and pregnant and lactating women getting lower priority. More than 30% of father and 20% of women believe that the children should avoid milk during certain illnesses, and for women during menstruation and for the first 11th day of the postpartum. Now let's look at some of the findings from KIA and focus group discussion. Meat was consumed almost 3 to 4 times a week in every household, and milk and eggs were prioritized mainly for the children. However, when we look at the milk consumption was widely varied across the different ethnic groups. Similarly, the father was the one who decided the food purchases in the household, and mothers responsible to allocate the food, giving higher priority to the children and elderly rather than adolescent girls and the women of childbearing age. Furthermore, high price, unstable income, and low nutrition awareness and misinformation were some of the barriers identified to ASF consumption. To address the gap identified in the baseline, nutrition curriculum including flip chart and snacks and later games for fun activities were developed. Based on the nutrition curriculum, we developed nutrition education sessions. Each nutrition education sessions was around 3 hours long and conducted monthly for mothers and adolescent girls groups and bi-monthly for fathers group. 16 nutrition facilitators were identified locally and trained before they were mobilized in community for nutrition educations, and they were coached regularly either before or during the nutrition sessions, and refresher training were provided to them as needed. Furthermore, 2 adolescent girls from the nutrition facilitators were selected as ASF ambassador, and they were mobilized for nutrition education in adolescent girls group. The slides shows the statistics about the nutrition education sessions. Nutrition education session was conducted in 26 mother groups, 8 adolescent groups, and 12 father groups. And 6 sessions was completed in mothers and adolescent groups, and only 3 sessions was completed in father groups before the funding was terminated. Nutrition education activities were carried out in nutrition clubs, and cooking demonstration was performed as a part of the model kitchen, where mother prepared and shared nutritious meal. Nutrition clubs organized school nutrition education activities and some cooking demonstration at the schools. The slide here shows the preliminary anthropometric data. However, the detailed anthropometric analysis is yet to be done. Now the early results. In the intervention arm, the adolescent girls and the other household members consuming milk in the 24 hours showed slightly increment. Similarly, when you look at the volume of milk consumed per day, the trend also showed upward trend. However, the full statistical analysis is yet to be done to identify whether they are statistically significant or not. So for the implications and scaling up, statistical analysis is needed to make the conclusion. However, it is already known that participatory community-led nutrition education may be an effective strategy to improve animal source food consumption. To design effective intervention activities, we recommend careful collections of baseline information, including knowledge, attitudes, and practices. Moreover, mobilizing local nutrition facilitators as well as ambassadors is the key to identify local nutrition problems and find out the local solutions for those local problems. Furthermore, family nutrition intervention approach, including fathers and adolescent girls, is expected to improve household nutrition outcomes and most importantly, collaboration with government agency for the sustainability of the intervention is highly recommended. So I'm grateful to one and all who were involved in the project, and thank you all. Thank you.
Thank you. Thank you very much, Milan. I would like to invite the next presenter, Namita Nepal, from Prasiti Agriculture and Research Center, Private Limited. And well, she's coming on floor. If you have any questions for Milan, please jot them down. We will have a question and answer session after 5 presentations. Namita, please go ahead.
Namaste and good morning, everyone. This is Namita, representing Prachiti Agriculture and Research Center. Yeah, so starting with this scientific animation without borders, so I would briefly like to give the introduction on what is the scientific animation without borders. So this is scientific animation without border is a program that creates educational animation in different sectors like agriculture, health, women's empowerment to provide free knowledge to the people of the developing countries. And this is a per the university program, and this program basically focuses on scaling for research or research for scaling. This scientific animations without border was initiated by 2 people, like one is Dr. Julia Bello Bravo and Dr. Barry Pittendrig, and this was started since 2011. And these animations are co-created with the experts, and then it is contextualized based on the geographical location. It is translated into different languages and made freely available through different platforms. Like one is the YouTube, which we have been using, and other is if anyone wants to use it offline, then we use it through USB drives. And then like if any one of us are interested in accessing this animated videos, then we can go through this link. So if we go through this link, then there are like more than 70 SWABO videos in the library. So coming to the background of the project, this project was basically supported by Legume Innovation Lab and Scientific Animations Without Border. So in the context of Nepal, we created this SWABO video to promote the lentil production in Nepal. And for this, we have like developed 15 videos, and this 15 videos is translated into 13 different languages based on the geographical location. And this basically focuses on the good agricultural practices for promoting lentil cropping systems in Nepal, and it majorly focuses on from site selection, soil health management, integrated pest nutrient management, and post-harvest loss management. This video we have developed collaboratively with Nepal Agriculture Research Council, Muktinath Krushi Company, Prachiti Agriculture and Research Center Private Limited, along with few of the experts working in the lentil sector. And this work is funded in part by the former US aid. So here we are coming to the geographical location for the project implementation. We basically focused on 3 provinces. That is the Sudur Pashchim province, Lumbini province, and Madhya province. The major reason besides focusing in this geographical location is that more than 80% of the lentil that is produced in Nepal comes from these 3 provinces. So here I would also like to thank Delivering for Nutrition 2025 conference funders, without whose generous support I would not have been able to present our work. And then I would also like to highlight that this project was funded by the United States Agency for International Development and was terminated for the convenience of the US government on February 26, 2025. Termination for convenience is a decision on policy changes of the government that occur during a whole of government review of funding and systematic changes. I think this is what majority of us have experienced. And I would also like to highlight that the project was not terminated based on the performance made by the Legume Systems Innovation Lab and Nepal Lentil Strengthening Activity. So talking about the approaches, here we, as discussed earlier, we basically develop the contents based on the animated videos and focusing on the good agricultural practices like site selection and everything as discussed earlier to promote the lentil sector in Nepal. And also we want to improve the supply chain management for the lentil and also boost lentil production in the context of our country. So the beauty of the SWABO is that it overcomes the literacy barriers as we translate the videos into different languages. For example, when we are using this SWABO video in Madhya province, we basically focus on Maithili language. In Sudur Pachim province, we focus on Tharu language. For Lumbini province, we focused on Awadhi language and Nepali language. And we work together with farmers and different stakeholders and try to raise awareness on using the good agricultural practices for the lentil production in Nepal. And then the reason behind promoting this, trying to promote this lentil sector is that we have a very unique characteristics in Nepali lentil. And since the market value is also high and it is one of the nutritious crop, we try to focus on this crop. And then without the support of our staff at the community level and without other stakeholders, it would not have been possible for us to implement the project. That's why they were the core part of our project. And then also the evidence which we have seen is that there is increased adoption of the improved practices among the farmers who were trained in this lentil, on this good agricultural practices for lentil. And we have also witnessed that the trained farmers are training their community members on this good agricultural practices for lentil as well. So coming to the findings, we have seen that demo plots using good agricultural practices yielded 160 times higher lentil harvest compared to traditional plots, resulting in a 68% increase in revenue. And this was after the input cost. And this, in our previous session, we are discussing engagement with the private sector. So we engaged with Muktinath Krishi Company, and then the advantage for us was that Muktinath Krishi Company did buyback guarantee with the farmers, so it was easy for the farmers to get the price easily. And then we implemented the project just for the period of 6 months before we received the stop order. And within this 6-month time frame, we were able to train 947 farmers, and with this 947 farmers, 598 were females and 349 were males. And we focused on each cultivation practices that farmers had to undertake to boost the lentil production. Also, the facilitators include our collaboration with the provincial government, local government, Nepal Agriculture Research Council, and Muktinath Krishi Company. So another thing is that since the farmers were interested and since the local government was also interested, in Lumbini area, local government itself have taken increase the support for the farmers who are doing this lentil production. That is also one of the positive point and success stories for us. And then other thing is that, as I mentioned earlier, the animations are made in different local languages. That's why it has been very effective use. And then while implementing the project, we also experienced certain barriers, like the extension services that had to be provided to the farmers were not enough. And then the inputs which we recommended in the video was basically recommended by NARC, and then the fertilizers and pesticides, which was already in the approved list by former USAID. But since that was not readily available in the market, there was a bit of challenge for us to get those inputs. So talking about the significance, SWABO's educational and videos enhance knowledge transfer, promote adoption of the improved practices, and address any literacy barriers. Also, this has helped to strengthen the farmers' resilience and food security. We have observed that farmer networks with lead farmers, multi-stakeholder platforms where we included all the value chain actors from producers to consumers, and then the SWABO videos in addition to the traditional extension training proved to be very effective. And to scale up this work, partnership with the farmers network are very important for us. Videos and platform are freely available for anyone who wants to use it or scale up the information. So this can easily be accessed in free from the SWABO library, I have shared the link in our first slide. Talking about the systems and partnerships for scaling up, we believe, and based on our experience within this 6 months of project implementation, lead farmers, multi-stakeholder platforms, extension agencies, and SWABO video play a very crucial role. And then to scale up this work, partnership with farmers network and lead farmers are also very critical. So here we can scan this QR code and then get access to the SWABO library. We can also use it in Android phone or anything like that, and the content can be used for the TV stations, TV screens, projectors, or Android phones. But yeah, here I would like to thank my team members without whose support it would not have been possible to implement the project at this level. So I would like to thank Barry, John, David, Eliud, Yubon, different personals from Muktinath Krishi Company, Sony, Tanka, Pramod, and Suraj. Yeah, with this, I would like to end my presentation, and if you have any questions, please feel free to reach out to me. Thank you so much.
Thank you. Thank you very much for this the fascinating the presentation. Next, we will move on to another interesting topic. The presenter is Sujan Sapkota, the program manager, HERD International, and he is going to talk about the scaling pollinator stewardship pathway to improve nutrition, biodiversity, and livelihoods in Nepal.
Good morning, everyone. Namaste. I am Susan Sapkota from HERD International, Nepal. My presentation title is Scaling Pollinator Stewardship Pathway to Improve Nutrition, Livelihood, and Biodiversity. Moving on to the presentation, this is the presentation outline. Starting from background, in 2019, we did a study, a longitudinal study linking nutrition, livelihood, and biodiversity. And we wanted to answer how will the pollinator population change impact nutrition, livelihood, and biodiversity. The study was conducted in rural mountainous district of Jumla district, where most of the farmers are smallholding, who are highly dependent on local agro-ecosystem services, extremely vulnerable to climate change and environmental degradation. Nearly half of the household face severe food insecurity. Average micronutrient adequacy is only 37%, under 5, as well as adolescent girls are undernourished. Key nutrient deficiencies, micronutrient deficiencies were vitamin A, B2, B12, calcium, and iron. Moving on to pollinator dependence, 3/4 of the crop species are dependent on pollinators. Wild pollinators and honeybees are declining in the region. Crop and wild flowering plants are crucial for forage availability and survival of the pollinators. Insect-pollinated fruits and vegetables are consumed only seasonally, and we also predicted that without pollinators, there will be 44% decline in household income and 23% reduction in vitamin A intake. For opportunities and solution, pollination is a key agricultural input, and which is free and also accessible with very limited income. And we also predicted that if we enhance pollination services, we can increase household income by 15%, including other micronutrient intake also. So with that evidences in hand, and reversing this pollinator decline in the region, we thought that if farmer, researcher, and extension workers and policymakers work together, we can reverse the pollinator decline. So we had this project, Darwin Pollination Project, in 2022, where 3 major components were included: pollinator awareness and stewardship program, pollinator capacity building program, and co-development of pollinator provincial pollinator strategy for Karnali province. And I will be more talking about pollination awareness and stewardship program and its impact. Pollination awareness and stewardship program have had 3 major components: awareness classes, which delivered pollinator conservation and apple orchard management classes to communities; demonstration farms that showcase the benefit of good pollination management; and farmer field school sessions, 24 skill-based sessions per year on climate resilient pollinator friendly agroecological farming and nutrition promotion were delivered. This was also implemented in Jumla district of Nepal. So we want to answer from this implementation, how effective was the pollination stewardship program. We want to know, does community-based education improve knowledge and adoption of pollinator-friendly farming? Do pollinator-friendly practice boost pollinator and plant density, diversity? Does adapting pollinator-friendly practice improve crop yield, diet, and income? Likewise, how and what drives or limit uptake of pollinator-friendly practices, and how the model can be scaled nationally or in the South Asia region. So moving on to method, baseline and follow-up surveys were done to know the impact on pollinator adoption and improvement in yield, diet, and income. Baseline and follow-up survey was conducted in both awareness class participants and farmer school session participants for the pollinators and plant density diversity impact. For the plant and pollinator monitoring surveys, 3 demonstration farms were compared between each other. Demonstration farms, which were model farm managed by project staff, and pollinator stewardship farm, which was managed by participating farmers, and control farms where no intervention were implemented. And surveys were done in 3 crops, plots: apple, mustard, and bean. For plant and pollinator surveys, plant density was measured through scan sampling using click counter, pollinator diversity through pan trapping using fluorescent pan traps, crop seed, fruit set, and fruit measurements were done. Flowering plant surveys using plant transect for plant diversity, and wild plant reproduction recorded using wild plant seed sets. Moving on to results. From the baseline survey, less than 1 in 5 farmer knew what pollination was. The awareness classes were conducted in 20,470 participants, out of which 1,390 were randomly selected for baseline, and out of which 60% of the baseline participants were followed up after 1 year of the intervention. And all the participating 180 farmers in the farmer field school session were included in baseline and follow-up surveys. So we can clearly see that increase in pollinators knowledge, insect pollinators mainly, and the adoption of pollinator-friendly practices, pollinator conservation practices improved significantly from baseline to inline. Awareness and practice of pollination management, like positive attitude towards biodiversity, knowledge of pollinator importance, almost equally increased in both awareness classes and farmer field school session participant. Whereas for the practice of pollination management, like practice of pollination management and reduction of pesticide use, were more effective in farmer field school session participant. For agriculture and nutrition impact, comparing with the control farm, farmer field school session farmers have had more than 36% apple yield, more than 44% of farming income. Jumli bean yield were increased by 3%, mustard yield were increased by 2%. Likewise, biodiversity was, dietary diversity was also increased in both awareness class participant and farm field school session, more likely to be attributed to changes in nutrition awareness rather than changes in pollination services. Likewise, livelihood impact were also increased in awareness class participant and farmer field school participants, where changes were more on farmer field school participants who were engaged for a long 1 year. Likewise, biodiversity impact percentage change from control side, we measured flower visitor abundance, flying insect abundance, flowering plant abundance, and flowering plant richness in all the sites, comparing with the farmers and demonstration farms. All the plots increased in biodiversity measurements, more in demonstration farms and than the farmers farm, which is well known that demonstration farm were managed by technicians and the other farmer field school were managed by farmers. So we have the impact that integrated pollinator conservation agricultural farming improves biodiversity, yield, nutrition, and livelihood. And key enablers for the program was evidence-based planning, locally rooted facilitators, peer-to-peer and practical learning approach were enabled, and key barriers were low initial awareness, remoteness, and limited services access were the, and scaling require embedding the model into agricultural policies, integrating into local extension service, institutionalizing, so, and partnership with all the major stakeholders. And in conclusion, we have the evidence that pollinator are declining and in the region, and adoption of pollinator stewardship program across the region can reverse this decline. In the next step, we are scaling this project into nationally, and one district will be scaled in 12 districts for field implementation, and Karnali pollinator strategy, provincial strategy will be scaled to national strategy. 2.73 million funding has been recently approved. And this will be the first national pollinator strategy in the South Asia. Thank you for all the conference and everyone involved in the project. Thank you.
Thank you. Thank you very much. Now I would like to call up the next presenter, who is Tasnoore Samina Kanam, from the Bangladesh Institute of Development Studies. Tasnoore, the floor is yours.
So good morning, and thank you for joining. I will present study on adoption gaps and implication for scaling climate resilient and biofortified rice, panel evidence from climate-prone area of Bangladesh. Rice is the foundation of food security in Bangladesh. It provides 58% of the daily calorie intake and 36% of protein intake per capita, and 92% of farming household cultivate rice. So when rice is affected, the food security in Bangladesh also affected. And when we think about the nutrition, over half of the population is zinc deficient and child malnutrition is high. So at the same time, climate vulnerability is the major challenge in Bangladesh, and farmers face frequent floods, salinity, and drought. So the climate vulnerability and nutritional deficiency in Bangladesh need a pathway towards resilient rice systems and food security. Rice diversity in Bangladesh is very rich. Farmers cultivate more than 1,000 traditional rice varieties and 130 modern varieties. Mainly two major seasons concentrated. One is almond, which is climate exposed, and boro, which is irrigated but high productive. Over the years, already 23 stage-on rice varieties and 6 zinc rice varieties have been released, but farmer-level adoption evidence is limited. So the objective of this study is to assess the patterns and determinants of STRVs and biofortified rice adoption to identify key barriers, opportunities, and policy actions to support the sustainable scaling within Bangladesh food system. So for this study, use the data from the Bangladesh International Research Institute. The survey employed a multi-stage sampling method to select the division, district, and villages. Total 1,485 households, which is covering 150 villages, 75 thanas, and 16 districts of 6 division was collected. And the low attrition rate was recorded in 2022 is less than 2%. So we use determinants to find out the determinants of the adoption of stage-on rice varieties and zinc rice. We use the multinomial logit. For the model, we estimated separately for the 2 seasons, it's rain-fed and irrigated, to capture the potential differences in adoption behavior across growing periods. So the result shows that climatic states remain high and volatile across Bangladesh. The climatic state is persistent and recurrent, and there are some also regional fluctuation, like the significant upward trends in Barishal and Dhaka. The flooding drives most climatic stress, but salinity also rising. And the farmer adaptation is emerging, but is still uneven across the regions. Submergence tolerance variety shows the strongest growth, especially in Khulna and Rajshahi. Dhaka remains the constantly low, although more exposed to climate stresses. For the zinc rice, uptake by the farmers is slow but accelerating, and is most notably in Borisal. So for the awareness, most farmers are unaware of the zinc rice varieties and also stage-on rice varieties. Farmers hear about these varieties through the Department of Agriculture Extension, and farmers also face difficulty to access the seed. The most the sources is formal sources dominate, but the barriers limit the adaptation. The farmers buy seed mainly from the formal market and face poor marketability, affordability, and availability of seed. So farmer prefer the seed according to major 3 characteristics. One is high yield, second is the taste, and third is the good market price. And from the table, we can see that the farmer uptake was high when they find that the seed is high yield and also has a good market price. So in case to see what are the climate shock and extension service affect the adoption, we can see it here. The experience of climate stress in the previous year significantly increased the likelihood of stress-tolerant rice varieties. Extension significantly increased the adoption of stress-tolerant rice varieties in almond season. And extension has no effect on the zinc rice, which contributes to lower adoption in almond. For the Buro season, we can see the experience of climate stress in the previous year significantly decreased the likelihood of zinc rice adoption, and female-headed households are more likely to adopt the zinc rice, while extension is not currently effective. So based on our findings, we can see that increase the adoption, it's need to increase the intensify the extension and awareness, and strengthening the seed system, and also provide the market incentives. And for the biofortified rice, it's the same, but it needs more additional actions, such as the differentiated channels, formulars, and aggregators so that will prevent the mixing with the other rice, and target the incentive and program like subsidies, social protection program, and demand generation partnership, and also promote the value-added products, branded or packaged zinc rice for the market price. So actually for the releasing the new varieties is not the solution. So we need to think about the policy intervention should be season specific, gender targeted, and prioritizing the station rice varieties in climate prone areas and promoting zinc rice through the female focused extension. Thank you.
Thank you very much. Can I ask the next presenter to come on stage? That's Dr. Wanjiko Dijochi, and she's working for World Fish in Malaysia. Wanjiko, the floor is yours.
Okay, good morning. Thank you for this opportunity to present, and I'm happy that I came after the other speakers because a lot of my work connects what the other speakers have spoken about, but also I speak about aquatic foods, which are important, especially when we think about South Asia and what can be done in light of the micronutrient deficiencies. So my presentation is around a plan we have, and after I finish, what I'm hoping to get is reactions and comments for what we are thinking to do as World Fish and part of the science programs. So we do know that in South Asia, there's high micronutrient deficiencies, and in this map, I'm specifically showing zinc and iron deficiencies among children and women. And we know the impacts of this, especially for maternal and child outcomes, but we also know it affects productivity, economic development, and so on. And so we need to address zinc deficiency, iron deficiencies, and all the other micronutrient deficiencies we know. I specifically focus on this because these are prominent, for example, zinc, iron, and so on in aquatic foods, again, that are very important in diets in South Asia. And because I talk about diets, I bring in this slide especially for Inge, who I'm sure is happy to see these slides, to say that diets matter when we think about micronutrient deficiencies. We did talk about systems approaches. We require different systems to come in, but we have to think about diets and how diets can respond to these challenges that we are talking about. And when we think about diets, again, as said in the morning, we have to think about agriculture. Many of these countries that we're speaking about in South Asia, we have huge populations depending on small-scale farmers for production of whatever they require to eat, but even the small-scale farmers themselves. And we know that agriculture has impact on diets through several avenues that I show on that slide. I'll not go into details around each one of them, but some of them that I can mention is that agriculture is important in increasing availability and access to diverse diets, but also in recognizing the importance of women in not only providing these diets, but as active participants in preparing and so on, and providing these diets to households. But back to the issue of animal source foods and thinking about micronutrient deficiencies. I show this specific slide that is from the recent released Lancet Commission report. And I don't know if you can see clearly, but if you look at the orange bars, which are specifically for South Asia, you consistently see a low consumption of animal source foods, even below planetary boundaries, so we are within safe boundaries to be able to increase the consumption of this. So if you look at, for example, red meat, eggs, fish, poultry, milk, consistently all through, you see a low consumption of this. There's a myriad of reasons for why this is. I think a big one is issues around affordability, accessibility, perishability of these foods. But I'm going to present an idea we have around addressing this. And this is just another slide, work from GAIN, that specifically looks at nutrient value scores. And Stella, I'm sure you recognize this work. And it again shows that animal source foods are nutrient dense and even score highly when you look at specific nutrients of public health importance, but also when you consider bioavailability and so on. And this work includes data from Bangladesh. So you see how animal source foods rank. And I'm sure I'm preaching to the choir, but the importance of why I'm showing this is just to emphasize the importance of thinking about animal source foods when we are looking to address micronutrient deficiencies in South Asia. So I'll talk about whether we can be able to enhance nutrient content of animal source foods. And this is what, the plan of the work that we have moving forward. Why do we want to think about increasing nutrient content of animal source foods? Number one, we draw inspiration from the work of biofortification. I think the presenter before me talked about the work around biofortification of plant source foods. And usually this is increasing nutrient content, sometimes also enhancing nutrient content, but also introducing nutrients that are not specifically in those crops. You can think about, for example, beans, and I'm showing some of the studies that we drew inspiration from, where we see that iron biofortified beans had impact on cognitive development of children in Rwanda. There's been work done in Pakistan around zinc and wheat, and I'll talk about this a bit later, but also work around pearl millet. So, the work around biofortification of crops has not been without its challenges, right? So I talk about some of these successes, but there's also been challenges around, whether when you see these nutrition status differences also result in, differences of public health importance, or whether they result in functional differences. And this is what we have in mind when we talk about increasing content of animal source foods. Trying to move to the next slide. Okay. Okay, so I'll talk about what we plan to do about increasing this work around increasing nutrient content of animal source foods. As well, fish, our target species that we are considering is fish. We consider fish because, of course, first, that is within our mandate to work with aquatic foods, but because when we conducted a systematic review to see what has been done so far and where there's been impact, there's been little work around fish, but we also know that fish is important in this region, so we focus on fish. The work would then involve specifically choosing which species would be important, and specifically this would be species that are consumed by majority of the population and are therefore accessible to them. So for example, we wouldn't choose to work with salmon, for example, that is, not highly consumed. But it would also be important to think about species because also animals in general by their biology can only accommodate certain amounts of micronutrients within their system. So the species selection is important, the acceptability, how it's consumed in that population and so on in terms of the species. And then there's the need to think about nutrient prioritization, which nutrients can be increased in these aquatic foods. Would it be polyunsaturated fatty acid? Would it be zinc and iron? But also, where are they stored? So for example, if you choose a fish species who maybe is not eaten whole, the head is not eaten, for example, and the nutrient is stored in the head, then you failed at what you're doing. So this is quite a bit of the work we have to think about, and then conduct experimental trials, which means thinking around how do you administer these nutrients to these fish? Is it through the water? Is it through the feed? Is it, those kind of things? And then thinking about bioavailability and finally conducting human efficacy trials. So I'm presenting a plan for this work. This work has not started. We're in the very early phases, and that's why we're looking for comments, reactions around this approach. But we know that there are challenges to this approach, and I just bring them up directly. I think the first question we consistently receive is, animal source foods are already nutrient dense. Why do you want to increase the nutrient content of this? And the response is, first of all, there are certain nutrients that we target, for example, polyunsaturated fatty acids and so on, that are low in these populations, but are also best delivered through animal source foods because of bioavailability, number one. Number two is also that we know that consumption of animal source foods, even in very little amounts, makes a difference. If we can increase the nutrient content of these animal source foods, it means also you don't have to consume a lot of it, even less amounts, to get what you need. And we also have environmental issues covered in that sense, because we are trying to remain within the planetary health boundaries. There's questions about acceptability, which has also happened with bioavailability, biofortified crops, where maybe the color changes, the taste changes, and so on. So these have to be considered, and this will be part of the work that we do. I think the biggest one that we are grappling with is, what about the cost benefits of this? If this is successful, because the cost of these animal source foods increase, and they're already expensive, who then gets nutrients drawn away from them because of this approach? Can we be able to keep costs low, and so on? So there are issues about cost benefit that have to be considered in terms of this. And finally, it's also to remember that this approach, just like any other approach, does not undermine the work that we have to do in terms of addressing systems issues. It's not a one-size-fits-all. We still emphasize that there's a need to address systems challenges, especially in accessing animal source foods because of their costs. Thank you very much, and looking forward to your questions.
Thank you very much. Okay. And thank you to all our presenters for their excellent insights. May I invite all the presenters to come to the stage, please? We now open the floor for questions. I invite the participants here in the room to ask questions, and there are 2 microphones I can see on the floor, so you can go to the microphone and ask your question. And also, please address the panelist or the speaker, the specific presenter, if you have a specific questions from them. And also, I would like to ask the session manager to check whether there are any online the questions from the online participants. Now we are open for questions. So there are 2 microphones standing up there. Okay. Yes, please.
First and foremost, thanks for all the presenters for invaluable study. So I have one specific question to the presenter who presented a study on scientific animations for lentil protection intervention. Is it Namita? So in your result sections, you have shown that lentil sessions trained for 947 farmers, includes 598 female and 349 men. At the same time, you have included that the videos are readily available for those who are interested to learn about that. So my question is, how did you choose those farmers, and do they have the access to any mobile phones or laptops or any other technical devices that they could access to your videos? And a follow-up, so what are the impact or the outcome that you gain from as inside stories at your community level work? Thank you.
We will go to the next question, and after a couple of questions, I will give a chance you to answer.
Or should I start? Okay, thank you very much for giving me this opportunity. My name is Deepak Thapa. I'm the chairperson for CISAN Nepal, and also the executive director for Intent. That's my organization. My question goes to regarding the barriers and overcoming that for increasing the male consumption in rural Nepal. This is a very interesting research also project as well. But the facts are, I want to know some of the facts regarding the reliability and validity of the project so that it can be scaled up to other rural villages of Nepal. The first one is the data given over here is data independent data or the project is subdued that. Because if you want to scale that up, validity and reliability is very much important for that. The second one question is, what is the exit strategy of this project? How much you have think, and in what direction, how this project will continue or taken over by the government or some other stakeholders? So these are the two important questions for me. Please, I have that question. Thank you.
Thank you. So after this question.
Good afternoon, everybody. Myself is Manbaz Shrestha from Caffordate College. So, thank you for the all presenter for good presentation. So, my query goes to Bangladesh Tajnure Samina. So, my query is a zinc variety of rice developed by the Bangladesh itself or from IFPRI. And another query is, during processing zinc variety of rice or zinc is losses, means polishing and husking as well as cooking. It is losses or not? If losses, how much? Thank you.
I think you got the questions, and we will give them a chance to answer, otherwise the audience will lose the connection. Okay, so who would like to answer the question? You can remind the audience the question a little bit and give the answer.
Yeah, thank you for the question. So the question to me was, how do we choose farmer, whether they have access to mobile phones or no, and what are the impact, right? So how we choose farmer is that we mainly go through the cooperatives and the local government, and then we try to identify which areas farmer have been cultivating lentil. So based on that, we inform the cooperatives that we have come up with this type of thing. We want to conduct the training for the lentil farmer, and objective is this. So based on that, cooperative and the local leader farmer will identify and then give us the name list, and they will arrange the time and then location for us to conduct the training. Right? And whether they have access to mobile phone or no, most of the farmers have access to mobile phones. So as I stated earlier, these videos can easily be downloaded or seen online in Android phone. And if the people do not have Android phone, then what we have been doing is that in cooperative, when we train, we take the USB drives, and then we have the projectors, so we are using USB devices in those areas where we are facing difficulty of the internet or for the people who do not have a mobile. And talking about the impacts, as I stated earlier that we have seen very positive impact, because beforehand farmers were considering lentil as an orphan crop. They don't used to implement the good agricultural practices for lentil. But with the development of the SWAVO videos into local languages, it has been easier for farmers to understand the content of the video, as we have translated all the videos in the local languages based on the geographical location where we are implementing the project. And yes, the farmers have been adopting the good agricultural practices for lentil, and to make sure that farmers have been using this good agricultural practices for lentil, we are working together with the cooperatives. We have like our We had field staffs at the place. We were working together with Muktinath Krushi Company, who were present at the field level. So with all those, we made sure that the farmers implemented the good agricultural practices. And of course, as I shared earlier, that we also did the demo plot to showcase the good agricultural practices from the content that was developed in the video. And with that, we found that there was 160% higher yield, as I presented earlier. And this has made a very good impact at the community level. Yeah, thank you. If I missed out any question or if you want more clarifications, then please feel free.
Okay, and the other speakers, can you just give a brief outline of the question and then answer?
Thank you. Thank you for asking the question. So your first question was about the zinc rice. Actually, this zinc rice is collaborated, developed by the International Rice Institute as well Bangladesh Rice Institute, but it's released by the Bangladesh Rice Research Institute. And the second question, when the zinc rice is milled and it can be polished, and there's some possibility also lose the contents of the zinc rice, but I don't have any data actually specifically that how much it lost. Thank you.
Thank you. That's another question. Yeah.
Okay, thank you, Deepak sir, for the question. The first question was about the reliability and validity of the data. For that, we actually hired very experienced enumerators for the baseline as well as inlines, and had rigorous training of about 5 to 6 days. So, and also after the data collection or during the data collection, we continuously monitor the data collection process, and we engaged a lot of time for cleaning and everything. So the data are quite reliable and validatable. And for the next question, that was about the ownership of the program by government or all. Unfortunately, the project was funded by the Livestock System Innovation Lab. So in the middle of the intervention, unfortunately, we have to stop everything. So, however, we conducted some of the advocacy level activities, like we advocated to schools and all to include animal source food, especially milk, in their midday meal program. However, because of the budget restriction, they were quite reluctant for the inclusion of milk and everything in the midday meal. Similarly, we advocated to the municipality and every other related stakeholders for their ownership. But hope if we can be able to get some other fundings, we'll be obviously working for this. Thank you.
Thank you for answering. So let's start a second round of questions. Can you first start?
Thank you. Thank you for giving chance. So I have the first question to the first presenter, Milan Dhaka. In your study, you showed that the animal source food and milk increase the intake, but do you explore the affordability, because we know the animal source food are expensive. If it is not the affordable, it will not sustain in future scale up. This is the one question, and the next one is zinc biofortified rice. It is developed by Bangladesh Rice Research Institute, and we know the soluble zinc is the animal source, insoluble zinc is a plant source. When rice is increased the zinc, it's combined with the phytic acid, anti-nutrient, it becomes the insoluble. And recently one RCT has done in Bangladesh, which showed that there is no significant impact on bioavailability, that is serum level. So without this data, you already released this variety to the farmers and you try to scale up. And the last presenter already showed, millet, it can increase, because millet is used, reduce the phytic acid by soaking, fermenting. But in case of rice, our habitual practice to cooking rice, we cannot soak the rice, reduce the phytate. So then my question, without this bioavailability data and why you are releasing the zinc biofortified to the farmers? Thank you.
Okay, thank you so much. This is Makub Sefer from WHH Afghanistan. So I have two questions. The first question for Saubo. It is really interesting and I appreciate the work. But my question is, the first, when it comes to the behavioral change, it takes time. So even within 6 months, you're mentioning that the yield is like 160%, even the revenue also 68%, that is amazing. So, but my question is, how looks like the acceptance of the community, the acceptance of the people, because we are talking about the behavioral change of cultural practice. And the second question, yeah, after the US funding cut, it was also, the project also affected. So how would the role of the government to take over and continuing like this result? And also, do you think about the market-driven approach for the future for the sustainability? This is the question for Savo. And my second and last question, I will come to one Jiko, world fish. Yeah, fish is, we can say, the most nutrient-dense food, and also easily like perishable, or like it can be easily deteriorated kind of food. So have you considered like the food safety when you are planning to like value add, or when you are planning to fortify this product? And again, like having the product is not our last solution. The solution should be, as you mentioned, it should be affordable and it should be also accessible. And also, have you seen, to reach the most vulnerable or through remote area, have you seen also the market-driven or for sustainabilities? This is the two questions. Thank you so much.
Thank you. There are 3 more questions. Please, can you keep it short and to the point?
Shall I ask?
Yes.
Yeah. This is Anjali from India. I have a question for the first presenter, Milan. I saw your objectives were about animal food, but your results were about the milk. Have you considered the recommendation in Nepal, that is once per day, and have you considered the Eat Lancet recommendation? The question to the second presenter, Namita, you spoke about in your results about food security, it was improved. What exactly did the dietary diversity improved or the adequacy improved? What was the outcome? Question to Samina, you spoke about female involvement in the policy making. Can we make it gender just, and can we have some solution in which we can involve men? And question to the last presenter, Vanchika, you spoke about animal source food and enhancing nutrients. Have you thought about consumer acceptability and sustainability issues? Thank you.
Thank you. Go ahead.
Hello. I'm Naomi Saville from University College London. I've got a question for Sujan. I was really impressed by the increases in pollinators that you found in Jumla, but I'm aware that Jumla has an organic district policy, so there's lower agrochemical use, especially pesticide use in Jumla. And I was just wondering, you know, in the Terai and in these parts of the hills where there's really excessive use of pesticides, how are you coping with trying to persuade farmers to reduce their use of pesticides so as to increase pollinators? Thank you.
Thank you. Then the last question, I have to disappoint you because, you know, we have to proceed with the meeting. Mashina?
Hi, this is Dr. Mashina from BRAC School of Public Health, Bangladesh. My question is to Wanjiku that for Bangladesh, we consume a lot of rice, and also a lot of fish, and that it is over our dietary guideline recommendation. But for adolescents, in my research, I found that adolescents are consuming very less amount, around 23 grams. So as you showed in your work plan or wild fish priority, that focusing on nutrients and from focusing on one single variety of fish species. So then, as a consumer point of view, it's wouldn't be very hard to, to feed one single fish. But as even living in whole family, children are consuming the less amount. But in data, we see it's 68 grams we are consuming at the household level. But at the adolescents are still consuming very low amount. And then what would be the trade-offs? I'm concerned about that. Would you consider working on those kind of questions in Bangladesh? Thank you very much.
Thank you for your questions. I'm sorry to disappoint you. We have to continue. We were instructed to gain some time in this session. So I would like to ask you to really have short and focused answers to the question.
Okay, short and focused. What a challenge. Okay, I think I'll speak broadly on the issue of animal source foods and concerning fish. Putting aside the bioavailability and increasing, the nutrient content. I think when it comes to affordability of animal source foods, there are broader systemic issues that need to be handled that also concern policy to make this affordable. But there are also other issues around addressing loss and waste, for example, and that's where food safety issues come in and handling, and how we train those that are involved in the value chain. When it comes to acceptability, back to the issue of enhancing biofortified, enhancing nutrient content of animal source food, I did mention that that's one of the things we need to look at, whether the taste changes, the cooking, the way the fish responds to cooking. And in terms of sustainability, as I mentioned that one of the criteria that we think about in species selection is looking at species that are broadly consumed by the population. So we are working on species that are accessible to most, often that are small fish, or tend to be things like carps and tilapia, hillshire in Bangladesh, and so on. That's what we are focusing on. I'll not go into other details because of time, but I'm available to speak to whoever has further questions. Thank you.
Thank you for asking the question. Actually, I didn't know about this one, but I know that if there are any controversy for the zinc rice, then Bangladesh government would not release that rice, like the golden rice. Already is developed but not yet released. But I think we need more research on it. Thank you. Another question maybe I missed. Someone is asking that how can we educate the female that I mentioned in my study. I think it's the intensive extension service, it's the female-based. That means in our norm that actually for the extension service, most of them are male, and they go to the male farmers and they don't go to the female farmers. So we should think about this one. So we need to give them knowledge, the female farmers, about the benefit and also the proper services to them. Thank you.
Yeah, I think the question for me was basically on this data thing where I presented that there was 160% more yield compared to the traditional farming. So this, we had demonstration plots where we selected few farmers, around 48 farmers, and then before the farmer used to use their own seeds, and after the project was implemented, the seeds were not from the saved seeds from the farmer. It was actually certified seeds and improved seeds. So with this there are many researchers which says that if we can use quality seeds, then the production can be increased by around 20 to 30%. And then we also have a data on each of the farmers, like what were the inputs used, what were the costs, and then deducting all those costs, we analyzed the data, and then with that data, we found out that it was 160% more yield. And then other thing is that before the farmer didn't used to use any good practices. They didn't use fertilizers, they didn't use herbicides, pesticides, those type of things. But after these all interventions were made, the production of the lentil was proved to be higher. And then regarding the market thing, as I mentioned earlier also in my presentation, we worked together with a private company, Muktinath Krishi company. And so during the initial phase, when we interacted with the farmers on how we are going to what will be the market for their crops, we had a buyback guarantee between Muktinath Krishi company and the farmers. So in that way, now also it has been going on that way. So since there was a buyback guarantee thing for the lentil, and the Nepali lentil has higher market price compared to the imported lentils if we go to the market and see. So in that way, we assured that there is a good market price for the lentil. And regarding the food security thing, increase in income and also availability and accessibility of the lentil crop, in terms of that, we have defined that farmers are more food secure after cultivating the lentil. Yeah, I think this is it from my side.
Thank you, Naomi, for the question. Yes, the study was done in Jumla, and intervention was also done in Jumla, which is an organic district of one of the organic districts of Nepal. And we are scaling up to 12 districts and 3 provinces in Nepal, which could have both opportunities and challenges in the coming future in regards with marketing, pesticide use, access to market, small holding farmers versus big farmers. So we do not know now how effective it would be. We do not have evidence, so I cannot say now exactly what will be the effect, because the study was done in rural mountainous district of Jumla. But of course, pollinators are declining in the region, and in all those 12 districts also there are pollinators declining, and this stewardship program will be effective. From our best evidence, we know that, but there will be other opportunities and challenges which we will be exploring in this project, next project. Thank you.
Very briefly, the first question was about whether you see whether the milk and ASF was affordable or not. In this case, initially what we had planned is we will just survey the household that have milking animals. But unfortunately, during the study, we found that only 63% of the household were having dairy animals or having milking animals. The major aim of our project was to test whether the intervention activity really helped to increase the milk consumption or not, and if the consumption of milk or animal source food increases, whether that will help to promote the nutritional status of children and adolescent girls or not. So that's why, unfortunately, we missed to collect information about that data. And the next one was we not only promoted milk during our projects, we also, as the baseline suggested, that milk as well as other animal source foods were equally not popular in the community. So we, while designing the curriculum, we also try to promote the balanced diet as well as other animal source food also. And for the recommendation, there is one recommendation from the Nepal itself, and now we compare our results with the FAO recommendations, and we are working to convert the data for the milliliters of milk consumed per kg body weight. Thank you.
Well, thank you very much. A big applause for the presenters. thank you for also patiently answering all the questions, and I can expect that there are more questions coming when we have lunch. Also, thank you for my co-chair, who co-chaired together this session. So there's still, the topic of this session was to integrate plant and animals food solutions. I did not see a lot of integration yet. I think there's still a big challenge ahead of us to improve diets, because that means, we have to look at animal-sourced food and plant-sourced food together in the context where we have to improve the diets towards more healthy diets. So there's still a task ahead of us, and I ask you to think about it, how to integrate your solution with the plant or the animal solutions that were presented also in this session. So thanks again for this session. The participants will get a certificate of presentation. We will hand out together, and then we will make a picture, and then I will release the audience to have the lunch, I think outside, right? Thank you very much.
Thank you, Inga and Renuka and all the presenters. Please take your certificates from the chairs and come forward for the group photo. We will have a lunch break now. We are running half an hour late, so the lunch break will be from 1 to 2 p.m. Please, our virtual participants, please note that we will start the thematic session 2A and 2B at 2 p.m. So you can also have your lunch and join us back virtually at 2 p.m. Nepal time. The next two sessions, 2A will happen here at Bagmati Ballroom on data systems at scale, and 2B will happen in the first floor in the Koshi Hall on synergistic solutions. So whichever session you want to attend, please either come to Bagmati or Koshi. Lunch is at the Naxal Square, the outside open area, and back behind the Bagmati Ballroom at the patio area. Enjoy your lunch and see you in 1 hour. Also, the virtual participants, see you in 1 hour. Thank you.